the school.
Thank you. Another question is, how do I go about applying for health insurance? And do I need to send my medical records along with application forms? Great question.
Yeah, so I wouldn't send medical records with your initial application. I would just apply to the school and send in the admissions requirements. A lot of times, college and universities will offer health insurance through them to students, and it's often actually a requirement for students to have health insurance. So I would research that. If you don't have your own, you can often get it through the college or university. Oftentimes you'll have to send in immunization records or something like that, but that's often much further down the line, usually in the summer before you attend school. So I wouldn't send anything as sensitive as medical records with your application.
Ever heard of universal health coverage? It's a big buzzword in global policy circles. Sounds promising. Or is it? In many countries of the global south, it's implemented through publicly funded health insurance for people to purchase a limited set of services. Too often, it's private healthcare providers that benefit most. They tend to use public money to promote high-cost procedures, draining human resources from public facilities and developing infrastructure only where profitable. But health is a human right, and public funds should go towards equitable public health care. An emphasis on insurance-based coverage skews public health priorities and pulls us further away from health for all. That's what's happening in India, where the government is using a health insurance model first implemented in the state of Andhra Pradesh. One study shows the scheme for hospital-based care has used 25% of the state's health budget to address only 2% of the burden of disease, excluding common conditions such as TB and diabetes. And because private facilities have received over 75% of total payments, it's weakened the public system and starved primary care. Is that the way towards universal health? We think not. There's no denying that public health services in India suffer from access and quality gaps. But the public system only gets 20% of the national health budget. And despite such underfunding, it provides 30% of hospital care and virtually all preventive care in the country. There are public alternatives to build upon. The National Rural Health Mission, for example, has improved public health facilities and deployed more health workers in rural areas. Tamil Nadu has pulled drug purchase and rationalized distribution in public health facilities where medicines are now available at no cost to patients. Sustainable public sector innovations like these are the real solution. Coverage won't cut it. Health care that is public and universal is possible in the global south. Health workers, activists, and citizens around the world are joining forces to make it happen. Health systems face all kinds of challenges, but the public path to universal health care holds the promise of comprehensive, integrated, and quality services based on primary health principles, more accountability and participation, improved equity, and greater solidarity. Will you be part of the change?
Millions of us now have health insurance under the Affordable Care Act, or what some people call Obamacare. But like many things in life, your health insurance can often be confusing and complicated. Whether you've been insured for years or you're new to the game, understanding your policy is important to your health and your wallet. First things first, you have to pay your premium every month or your insurance could get canceled, kind of like your cable subscription. You can also think of it like a shared healthcare piggy bank. We all chip in each month, even if we're healthy, so the money is there when we need it. If you get insurance at work, your employer probably pays most of your premium, and the rest comes out of your paycheck automatically. If you have Medicaid, you most likely don't have to pay any premium at all. The federal government and your state take care of that. If you're insured through a new health insurance marketplace, depending on your income, you may be eligible for a tax credit that pays a portion of your premium. Once you have that shiny new insurance card, you'll want to try really hard to keep it in your wallet. To better your odds at staying healthy, be sure to take advantage of the free preventive services that all new insurance plans provide. But of course, stuff happens, and that's when insurance really comes in handy. Now, having insurance helps a lot, but it doesn't mean all your health care is going to be free. There are lots of details about your insurance plan that affect how much you pay when you get sick or injured. If you have Medicaid, a lot of these services could very well be free. Otherwise, you'll likely have to pay something when you go to the doctor or fill a prescription. This is called a copay when it's a specific dollar amount, like $25 per visit, or coinsurance if it's a percentage of the bill. There's also the deductible. That's how much comes out of your own pocket before your insurance starts paying. Depending on your plan, you might have a deductible for all your care, or it might only apply to some types of care, like hospital stays and prescriptions. So read your plan material, because it could add up to thousands of dollars. Another important part of your plan is the out-of-pocket maximum. This is the most you'll ever have to pay in any 1 year, at least for the benefits your plan covers. Your insurer will pay 100% of anything beyond the maximum for the rest of the year. It can be just as confusing dealing with prescriptions. Your plan has a list of drugs it will pay for called a formulary, but the prices vary. Check with your doctor or pharmacist because a generic drug might fix you up the same as a brand name drug, but the price difference could be huge. So, those are the costs typically involved. But remember that they'll be affected by your insurance plan's provider network. This is a list of doctors and hospitals that are connected to your plan. Insurance companies negotiate discounts with these providers. Stay in network and the discounts get passed to you. Go out of network and you could end up paying full price. And remember that out-of-pocket limit? It won't work if you go out of network. In some plans, like HMOs or EPOs, your insurance would pay nothing if you go out of network. In other plans, like PPOs, your insurance will cover you no matter where you go, but you'll pay a lot more if you go out of network. Also, if you want to visit a specialist, like an orthopedist, some plans require a referral from your primary care doctor. Sound easy enough? Well, sometimes staying in network can be tricky. In a hospital, it's possible that your surgeon could be in network while your anesthesiologist is not. If this happens to you, don't be afraid to negotiate with your provider or file an appeal with your insurer. So as you can see, there's a lot to think about when you choose an insurance plan each year. Some plans may have low premiums, but fewer doctors or hospitals and high deductibles. There are trade-offs, and understanding and choosing among plans isn't always easy. Remember, if you have questions, call your health plan and ask, or check with your hospital or doctor. If you still have questions, your state insurance department or consumer assistance program can help. With the Affordable Care Act, there's new support for consumers, so take advantage of it. Having health insurance protection is a good thing, especially when you know how it works. We hope you're now better prepared for the next time you have to pull that insurance card out of your wallet. Stay safe, America.
At V Technologies, we pride ourselves on being the most trusted source for reliable, fast, and accurate processing services in the industry. V Insure is the insurance services division of V Technologies, offering end-to-end healthcare insurance claims processing and administrative services. Under the wings of Sonia University, V has unparalleled access to the best of the best in each graduating class, providing V with the talent needed to deliver the most superior services possible. We have knowledge embedded in our DNA. V owns world-class training facilities and makes quality its top priority, providing rewards and incentives to its staff for meeting and exceeding their quality targets. Our differentiators set us apart from the industry. V is one of the few HIPAA-compliant companies outside of the U.S. and is also fully HIPAA certified by TÜV Rheinland. V uses a unique process which breaks each healthcare claim into 4 parts, and each is handled by a different agent. No one person sees the entire claim, which contains proprietary patient identifying and medical information when together. Employee turnover is a major issue for many India-based BPO firms, but not at V. While most Indian firms experience 30% plus employee churn each year, V has less than 12% churn and about 5% at one major facility. This allows us to deliver the best SLAs in the industry over an extended period of time. In fact, V has never lost a client due to service quality. Our expertise leads into a diverse portfolio of healthcare insurance-related services, ranging from intake and front-end services, claim processing services, claim repricing and provider maintenance, claim payment and adjudication, and related value-added services. Our knowledge base and proven processes allow us to deliver an integrated spectrum of insurance data processing solutions, whether it's providing enrollment and eligibility services, automating COB processes, or provider data management. V-Insure executes results around the clock to achieve your specific business goals and objectives. In the past 6 years alone, V-Insure has processed more than 50 million claims. What makes V so attractive to our clients is our dedication to premier quality. Improving our clients' flexibility and response, our talented team can provide an accelerated turnaround time of 12 to 48 hours at 6 Sigma quality levels. We believe there's no one-size-fits-all approach when it comes to a medical claims processing system. We have experience in working with all major platforms in the industry, including TriZetto Facets, EMC's Action Point, and Captiva. We have also built our own systems and software, which we use for various clients. Claims payment and repricing is a very difficult process. Put V-Insure on your side of the equation to get this done right the first time. Our claims adjudication services include verifying eligibility, duplicate claims check, coding, bundling and diagnosis, hospital detail analysis, benefit determination, and rules-based edits. More and more clients are choosing V-Insure to handle their enrollment and eligibility process. Our VCAP software validates checks in the system, which then help our enrollment and eligibility specialists search for and clean up demographic discrepancies at the time of the enrolling patients, saving you valuable time and money. U.S. insurance companies pump out $60 billion in fraudulent claims every year. No company can be too protected from this liability. V-Insure has the right systems in place, such as provider and fee schedule matching, and provider selection and database validation to guarantee that this doesn't happen to your company. Your best fight against fraud is V-Insure. EDI has become a critical strategic business tool for companies to share data. V-Insure's EDI system can securely transport your private data between systems and partners with no errors. EDI integration leads to reductions in administrative cost, fewer clerical errors, and lightning-fast transaction cycle times. Other benefits you'll see include improved inventory management, communications, training partner relationships, and customer service. V has established industry-leading security requirements. V's security certifications include SAS 70 Type 2, ISO 27001, and the risk assessment standards of the SEI Carnegie Mellon's Octave tools. V has passed all independent security audits conducted by several leading U.S. insurance providers. Our brand promise is to offer quality in every transaction. With V-Insure, we guarantee you trust in every transaction.